Yeah. It's not on there. Right. Come on back over. A little more. Which way? To the left or right? To the left. Right there. Now come down. Come down. Down, down. You're going up. Come down. Come on, keep going. You're on the minbar right now. Come down. Come down. Come on down. Right there. Yeah, but it's blurry. Now go, can you take it back? Like bring it back. Like it's too close. Go back. Right. Go back a little more. Right there. dark.
No, I'll speak. You put a chair on that? This one? Yeah. It'll be too high, no?
We're gonna see.
You put a book or something? Yeah, but it's not long.
That's why. White boy,
Put it there. Can you get on the screen? I got you.
We're on YouTube now for this. Hold on, see, we were live here now, but I don't know if I can put a YouTube video that's live. I don't know if I can do it.
That's not.
All right, so
I'm gonna start this like that.
can we just do it? I guess we have to do audio.
Yeah, we just.
Okay, well, they can hear.
Assalamu alaikum warahmatullahi wabarakatuh. Alhamdulillah rabbil alamin, wassalatu wassalamu ala rasulillah ashrafil anbiya'i wal mursalin. Dear brothers and sisters, Masjid is presenting health awareness, Ramadan health awareness. Unfortunately, the steps, the way I wanted to show it to you to bring it to real life, and zero in understanding, probably is not going to happen because the projection is not going to work. So we're going to do this of our ability, inshallah, trying to convey the message of health awareness, how we should take care of ourselves. This is the month of Ramadan. Allah subhanahu wa ta'ala perhaps wanted us to be healthy believers. Rasulullah sallallahu alaihi wasallam said, stronger believer is better than weak believer. So, stronger believer need healthy body to worship Allah subhanahu wa ta'ala, healthy life. If we are not healthy, then there will be hindrance in our worshiping Allah subhanahu wa ta'ala. So that's why we want to know how to maintain our health in a good way. Especially we are focusing on high blood pressure, so common in the society nowadays. High cholesterol is very common. Obesity is almost 1/3 of the people are obese in this country. And it's not only in this country, it's a global issue, obesity. Either from the food we eat or the lifestyle we maintain, we are kind of lost the control of our body. People are becoming more obese globally. So we're going to focus, inshallah, on these few things, inshallah, how to keep good health. Obviously, as I mentioned that, I wanted to present it in a very realistic way with the pictures and video clips, but I guess this is going to test my ability to how good I am at expressing myself. So we'll start with the heart. Heart, where we start our healthy life, healthy body, if you wish. Because heart is the one that pumping the blood every single moment of our life. That heart, everybody, every single one of us has it, is pumping contracting and relaxing every single second. And that heart, if we want to understand the roof, Islamic term roof, we can physically see the heart, that roof is in the heart, because that heart is contracting and relaxing. Once it stops, then we are done, we passed, we done. So that roof is in the heart, just to understand this. So the heart is pumping by the command of Allah subhanahu wa ta'ala. And it's going to keep pumping. It's never going to become tired. Our body gets tired, but the heart is going to keep pumping. Once the command of Allah subhanahu wa ta'ala comes to the heart, then that's when it stops. And we die. We ask Allah subhanahu wa ta'ala to make a pleasure to meet him when he decides to take our heart, to take our road. Amen. Until then, though, we're going to live. We're going to maintain our life. We're going to maintain healthy lifestyle. What to do in that case? Rasulullah sallallahu alayhi wa sallam, he mentioned, Inna fi jasad al-mudda. Inna fi jasad al-mudda. Wa iza salahat, salaha jasad al-kullu. Wa iza fasadat, fasada jasad al-kullu. In the body there is a flesh, a piece of flesh. If that flesh is good, everything is good. If the flesh is corrupted, then everything else is going to be not good. And then Rasulullah said, verily, that is the heart. So the heart, where we think the ruh is, if the ruh is taken, heart is dead from pumping. Since it is pumping now, our responsibility according to the hadith is to maintain the healthy heart. Because if the heart is good, everything is good. If the heart is bad, then everything is bad. This hadith has a connotation, I think, from the psychological part more than the physical part. But since we are in the month of Ramadan, we want to talk about the health awareness. Let's talk about the physical part of the heart, which, as I mentioned, high blood pressure, cholesterol, diabetes, obesity, all of these could make our heart sick. It could be ill. And it could have life-threatening, devastating incident or disease from the heart if you don't control, if you don't take care of our heart. So, among the diseases of the heart, high blood pressure, hypertension is one of the most important to discuss. Not only is life-threatening, but it also so widespread. So widespread, about 48% of the people in this country have high blood pressure. 48. If we have 20 people here, 10 of them walk around with high blood pressure. So this is something very important for us to look into. This is very important for us to screen if I have the high blood pressure. Because once someone has high blood pressure, if they don't know that the person has high blood pressure, that because of the high blood pressure, it could have impact in our brain. We could have stroke. It could have impact in our heart. We could have heart attack. It could have impact in our kidneys. We have kidney failure. This is a real-time talk. This is a real-time cases, actually. I have patients like us. Maybe the patient is in 30s or 40s. I said, when did you find out you kidney failure? They said a few weeks ago. When kidney fails, it doesn't happen overnight. It doesn't happen over weeks. It's matter of months, years. It takes for the kidney to give up on us. So maybe the person had high blood pressure. And again, I asked, continue asking, then how did you find out? What did you find out what caused it? And the person said high blood pressure or diabetes that people didn't know. They have it, they never screened it, therefore ultimately consequence was losing the kidneys or having stroke or heart attack, so on and so forth. So it is important for us to be healthy by having it screened, especially in this country where we live. It doesn't take much for us to screen our body once annually. It doesn't take much. If you don't have money, the Medicaid is there, Medicare is there. They are ready to help us out once we need to get that. So, consequence of high blood pressure is very heavy. Actually, high blood pressure is called silent killer. Silent killer. As I said, the patient would know they failed the kidneys or they have heart attack and others until the thing happens. Until it happens. So it's a silent killer. If the pressure is continuously high, it has pressure in the blood vessels. In the blood vessels. It consistently applies pressure in the wall of the vessels. Walls of the vessels inside. So over the time, when one person has consistently high blood pressure, over the time that blood vessel gives up. If you were to just imagine your garden hose, you have it used so long, and suddenly you see some tear, and the water is leaking because the pressure in the garden hose. Same thing goes, same concept is in the blood vessels. If it's consistently high pressure, then one day part of the vessels is going to give up. Now let's talk about the vessels by itself, as I mentioned. All the vessels in the heart, if we line them up, how long do you think it's going to be? The blood vessels, arteries, veins, capillaries. These are the blood vessels in the heart. If we line them up, how far they go? What do you think? How long is the length? That's a question. You want to answer?
Say, 5 feet.
Feet? Okay. If you take a plane, come around the globe, planet Earth, along the equator, along the equator, the fattest part of the globe. If you take a plane, come around the Masjid, when you fly from here, come back around Grand Canyon, California, Pacific, Japan, China, Australia, come back on the Atlantic, come to Middle East, and then pass Atlantic again. If you come around the globe, the distance is more than 45,000 miles. Then how many hours of flight? 500 miles per hour is the flight nowadays. So we have to fly 50 hours to cover the distance. Guess what? If you put your veins and arteries to the capillaries, it's more than 60,000 miles. So if you come back once, twice, more than twice around the earth, distance is even more than that. It is something to look at. So this more than 60,000 miles of distance, heart is pumping about more than 2,000 gallons of blood every day for us to live. Heart is pumping more than 2,000 gallons of blood every day, more than 60,000 miles to keep us alive. In return, our heart does not cost much. Our heart agrees to do this job for us. Only the heart is asking us, feed me healthy food. Feed me healthy food. Because if you are going to feed me, I'm acting as the heart. If you are going to feed me unhealthy food, if you are going to feed me oily, fatty food, if you are going to feed me sugary drink, then that sugar, that fat is going to be in the bloodstream. That's 60,000 miles, that fat is going to circle around, sugar is going to circle around. And one thing about our blood vessels, if you put a lot of sugar in it, blood is going to be very thick. You will have problem going through the capillaries, the microvessels. You will have problem. If you are going to eat a lot of fried stuffs, fatty stuffs, oily stuffs, blood is going to be full of fat. And the blood will have problem circulating through this more than 60,000 miles distance every day for us. So, how to live healthy then? The healthy living means I am going to have my balanced food. You see, we are fasting now. All of us are craving, I'm going to have that chicken. I'm going to have that sugary drink. We are craving. But we are not thinking healthy. If we are to think healthy, then we're going to probably say, I'm going to have a baked and maybe a cup of milk. Actually, the nutrition you have there, the energy you have there, the calories you have there, that should really fine. You will be healthier standing behind Imam Abdulaziz, finishing, 8 rakat, and then you will be probably asking for more. If you maintain the healthy eating it. But if we don't, then, things will catch up. And unfortunately, the food outside, we also have to pay attention to. Most of the food outside is full of sugar, full of fat, full of oil. And we are attracted to that. We have craved for that. So unfortunately, it is not easy to hold us back from that kind of food. But our heart demands us to be eating healthy food. Otherwise, the consequences would be different. So, high blood pressure. So now you are all worked up. You go to your doctor tomorrow, you check your pressure, and your pressure is, let's say, 120 over 80. And your doctor smiles at you, your pressure is normal, good. So you are more celebrating by getting more pressure. Now, what if the pressure is, let's say, 140 over 80? Or even, what if that number is 150 over 100? Right? What those numbers mean? Definitely, those are the elevated number, or we call it high blood pressure. The impact of those pressure, as we discussed, that is going to be inside the blood vessels where blood is flowing. And if that blood pressure is consistent all the time, your blood vessel is going to be blocked. It's going to burst. If it's going to burst in our brain, that's called stroke. Depending on how quickly we can go to hospital to take care of the stroke, and depending on how vessel, how big it is that burst, the outcome may not be that good. So if that burst, the blood vessel bursts in the heart, we call it coronary arteries, then we have heart attack. And again, it depends on how soon we can get the medical help. That could be devastating. Heart could go on shock, and heart could stop. If that blood vessel bursts in the kidney, you may not know, but eventually 1, 2, 5, 10 blood vessel bursts in the kidney is going to start to die. And then you're going to have kidney failure. So all these complications could come from high blood pressure. And it is important for us to live a healthy life and visiting our doctors to make sure our numbers are in range. So we conclude that talk on blood pressure. If you have any question, you can go on that. Take it. Otherwise, we'll move into settings.
I have a question. You said like sugar is not good for the heart. What about natural sugar, like fruits? Is that bad? Like
So if you have problem with the sugar to begin with, then you want to watch all the sugar. If you have problem, you are prone to diabetes, then you can watch all the sugar. And you take it in moderate amount. This is where we are kind of bridging our religion with the medicine, which is supposed to. Opening the fasting. So now they have, if you don't have to take the whole day. They will take care of it. If your sugar is there. Okay? You also have to consider the food you are eating, what the nutrition value is. If you look into it, it has carbohydrate, which you need moderate amount. It has protein, it has sugar, all of it moderate amount. Nutrition list is very good in the day. So again, moderate amount, right? Bring down the blood pressure. So as I said, that's 60,000 miles of distance. The blood is traveling. If you are going to have days, it's sugar in it. With sugar in it, if you have problem with the sugar, it's going to thicken the blood thickness. And you're going to have problem passing the blood through the capillaries. Right. We're going to come to diabetes next, inshallah. But for now, again, moderate amount, right? We don't, dates is not medicine to lower the high blood pressure, wherever you are from. It's not.
about fatty foods. I heard some fatty foods good, such as olive oil. Eat olive oil.
Okay, so in the fat, they have something called saturated fat and non-saturated fat. Olive oil happens to have non-saturated fat, and which is okay in moderate amount. Okay? It's not that you have high cholesterol and then you're going to treat that with olive or olive oil. That's not a very
What I'm saying, if we eat or use olive oil, it won't, I mean, it may cause it excessive, but just to use it in moderate.
So let's talk about if you have that high cholesterol, If you have high cholesterol, some of your blood vessels are already clogged, or they have layer of fat in the inside the vessel. You are not going to treat that or get rid of that plaques or fat by using olive oil. You're not going to treat that.
Right, we're not talking about treatment, we're talking about eating.
You eat. You eat, if you want to eat only that, that's wonderful, that's a good diet. That's why without fat and all this stuff, well, that's a good diet. You can have, but moderate on. Only because this olive oil, there is a limit to how much you should be taking.
Next question.
Yeah.
As far as, how we want to go about breaking down the sugar that may be in, how do they break down the sugar that may be, I'm not saying they're diabetic or not, but, as far as them, having high sugar content.
So come to the diabetes next time. That's what we're doing. Okay? Anything else? Or have your question?
I got another question. Like, how important is walking? Like, 'cause I mean, you said a lot of people obese. And I was thinking, like, possibly we do to like, the exercise because like a lot of people drive or they take the bus or they sit down. But I was reading something about 10,000 steps a day. They're saying that's real. Like basically, if you like lose 10 pounds, so it could you'll go from like diabetes, folks, you'll go. I think stage 1 is the worst. The worst stage 1 is diabetes.
So let me just put this, I'm sorry. Obesity is second next topic. We're going to come to that inshallah. How much calorie you're going to take and how many miles you're going to walk to break down or lose that calorie. I think that's what we will have. If I don't address that, ask me.
Yes, it's
Yeah, that's it.
I have a question. The pressure should be 120 over 80.
That's we consider normal. Below less than 120 over 80.
No matter the size of the person, it should be.
There are people who have low pressure to begin with. So if you ask me, my pressure is 110 over 70. If I go 180 over 120 over 80, that's my average. So you have to know where you are exactly. You need to know your baseline. But average 120 over less than 120 over 80.
Can high blood pressure be hereditary?
Sure. Some people they're born with high blood pressure, and they have to know that and they have to treat that. Otherwise, the consequence will be same as anyone? Question from there?
But what's your recommendation to lower it? If you have high blood
Okay, lowering the blood pressure. I'm going to have one recommendation for lowering blood pressure, sugar, obesity, these 3 diseases. And I want to connect that to American Medical Association or CDC. Their recommendation is the first line treatment for all these 3 is diet and exercise. The first line treatment. Okay, you got to remember this. I'm going to come back to it later. It's very valuable statement, especially in the month of life, diet and exercise. This is the first line treatment for high blood pressure, cholesterol, diabetes, and obesity. Right? Anything else, sister?
You take diet and exercise, so what would be the food or drink intake recommendation? Like garlic, ginger root, what would be your recommendation?
Okay, so then you need to sit down with your medical doctor, figure out for yourself what is proper. That depends on your body habitat, your age, your family history, and what situation you are in already. That's a customized This we have to make with your blood test, with your liver test, kidney, all of this you have to put together in our examination. Right? We move on because it's going to be for next week. Inshallah, right? Move on to diabetes. What is diabetes? They call it sugar disease. Sugar disease, diabetes. Simply put, the iftar you're going to have, so inshallah. Once you chew it down, the sugar content of that food is going into the blood. In your blood, again, blood vessels. It's carrying that sugar 60,000 miles in the blood. That's a normal person. That sugar is supposed to be controlled by your liver. Excess sugar, you should be using it to exercise or cut down the diet, so on and so forth. Now, in the diabetic patient, what happens? That sugar from your iftar went into the bloodstream, circulating around 60,000 miles in your body. In diabetic patient, that sugar stays in the bloodstream. It does not, you don't get any energy from that sugar. Ideally, that sugar is supposed to be broken down by a hormone called insulin from your pancreas. I have nice pictures, unfortunately, I live with them, so I have to kind of describe it. The pancreas is an organ in the body, posteriorly, behind the stomach, under the stomach, right, sitting there. Whenever we eat sugary food, pancreas secretes insulin for us. That insulin comes into the bloodstream. Sugar is walking around with. Now we are fasting, we are tired and exhausted. Once you have that food in, sugar is going to be come with insulin and they get into the cell, blood cell, I mean not blood cell, in our muscle, for example, in the heart or in the brain, and it's supposed to give us energy. So after eating food, you feel energized because your insulin took the sugar into the cells, and cells break it down into energy, and you feel energized. In diabetic patient, this mechanism is missing, or is not enough for the person to really have energy. Is it enough to understand? Again, in diabetic patient, insulin is not helping that sugar get into the cells, which is supposed to give us energy. Is that mechanism, that link is missing or is not efficient. That's why we don't get energy. No matter how much we eat, how much sugar we put into our body, we don't feel energy because diabetic patient, they are not making energy out of the sugar. So this is a problem with the diabetic patient, right? Complication of diabetes. What happens since the sugar is not breaking down and making energy, this sugar is circulating in the blood. When it comes to kidney, it sticks to the kidney. When it comes to liver, sticks to the liver. When it comes to blood vessels, red blood cells, for example, sticking to the red blood cells. And making the blood thicker with sugar. So this is the sugar is a problem. Now, we said more than 60,000 miles of blood vessels we have. A lot of them are microscopic, very tiny. And then sugar molecules, it depends on what stage of the patient is in diabetes, sugar molecules don't get into the capillaries. That's why this diabetes is called microvascular disease. It attacks your eyes, attacks your heart, attacks your brain, attacks impacts your kidneys big time. Number one reason for kidney failure is diabetes. And diabetes because it's not, the cells is not using their sugar to have energy for the organ to function properly. So that's why there is a complication. That's why diabetic patients are to go to check their eyes, right? To check their feet, because these are the area they are not getting enough blood. That's why diabetic patients, when they have surgery, their healing process is very slow because they are healing that cells are not getting proper energy from the sugar and nutrition they are not getting. That's why they longer time for them to heal. So this is the complication of diabetes itself. So how do we treat diabetes patients? Who can tell? I gave the answer already. Diet and exercise. Diet and exercise. Yes, sir. We're coming there. Thank you for reminding me. Okay, so diet and exercise. Let's highlight that point, Sister. Diabetes is two types. One is type 1, one is type 2. Type 1, these people have problem with the pancreas that's secreting the insulin which is supposed to break down sugar. So what happened in type 1 people, their pancreas is big, they are not producing any insulin. So they have to inject themselves insulin periodically to keep up with the sugar. So that diabetes, type 1 diabetes, actually very common in younger people, but it could happen to anybody, anytime in their life. This is, they call it autoimmune system. Means your immunity woke up one day and go on to killing your organ. So that could happen to any organ. And in diabetic patients, it happens to be they kill the pancreas, therefore they have no insulin to produce. It's called type 1 diabetes. Type 1 diabetic, their alertness, cautiousness is very, very important. They have to monitor the sugar, they have to keep the candies with them, or some sugar with them. If it is go low, they have to check the blood sugar, and if it's low, they have to take anything to bring it to balance.
What is signs when a person should?
Signs. Traditional signs are first, going to the bathroom. These are traditional ones. But if you feel these, then you go to doctor and do the blood test. 1, 2, 3 stage of blood test. And then they will conclude from there. Okay. Anything else on diabetes? Okay, so as we discussed before that, same thing true with the diabetes patients. Even it's worse in the diabetic patient because diabetic patient, remember the nutrition is not getting into the cells. So in microscopic level, the blood vessels are already tired. They don't have nutrition there already. So in that case, you want to be more careful when you go, eat fatty food or sugary food. It's going to just make it worse.
Would it be wise to see a nutritionist for people who are diabetic?
All the time. All the time. Because you need to know how much calorie intake you should have. Especially if the diabetic patient are in a stage where their diabetes is 200, for example. You need to periodically see the nutritionist to set up the plate, what you want to put in the plate, how much you can take.
So what is the number range for what's considered normal blood sugar?
70 to 100 is normal, considered. If you are not fasting, more than 126, to check your blood finger stick. If it is more than 126, not in one operation, you Or if it is, they have sugar tolerance test where if it is more than 200. So there are few ways they can decide on the criteria to diagnose you if you're diagnosed or not. If someone has 110 sugar, for example, apparently it's a normal number or close to normal number, but add that with your obesity, add that with your high blood pressure, add that with your high cholesterol, then you are qualified to take medication in addition to diet and exercise.
Doctors use the word borderline. Define that. Borderline diabetic. What is that?
Borderline diabetic, they have new criteria, they change it almost every year. If your fasting sugar is less than 100, you are borderline diabetic. So if we were to check sugar on everybody now, if you are around 100, actually you are borderline diabetic. If that's the only problem you have, you go with the diet and exercise. But if you're going to have, they call it comorbidity, where they have high cholesterol, high blood pressure, along with 100 sugar, then you have to be serious. It's time to be serious.
So what about the A1C? How is that figured?
So equivalence to A1C, if we check my sugar now, if it is 127 now, that is equal to A1C 7. So it is recommended to keep it below 7. Again, providing the fact you don't have any other problem. Okay, just the sugar by itself. So keep it below 7, A1C, or below 127 is ideal.
What if when I get the sick, my number is 89? That would be my
That's your blood sugar. It's not A1C. You convert that. There is a conversion. So yours would be like 5 or so with that number. 5 or 5.5.
borderline pre-diabetic is what?
Pre-diabetic would be your A1C would be 6.4 or more. Right?
I know when I did my A1C check, it's over a 3-month period.
Today,
With my doctor,
Mhm.
it's over a 3-month period that he checked my A1C. So like,
3 months period.
yeah.
Okay.
I guess that may be just for me.
No, so this is how it works. A1C, remember the red blood cells we spoke about, the blood vessels. The sugar you have, it sticks to the red blood cells 3 months. Okay? So if I want to know your A1C for the last 3 months, I'm going to check your blood test from the blood cells, right? Red blood cells, and you give me that number, either 6 or 7 or 8. So that's why every 3 months is the time to take to see if there any change within the last 3 months.
Other question. Some of the prophetic medicine, vaccine. How does this affect vaccine? There's a lot of vaccine. Does that affect either one, the blood pressure or the sugar?
So medicine is ever changing. What was true 10 years ago, 20 years ago, may not be that true today. But prophetic medicine like black seeds and honey and other stuff, those are not statistical, they are heavenly. Right? If you have high cholesterol, high blood pressure, any other medicine, Prophet said the black seed is cured for everything except death. We take it as is. We're going to take that, hoping Allah subhanahu wa ta'ala is going to cure my diabetes. At the same time, we do the other steps also. Alright? We don't know what Allah subhanahu wa ta'ala did. So we follow the guidelines, and then we do those. Anything else as far as diabetes?
You're taking back feed, sugar, things like that. So you're taking it, you expect it to cure you, right?
Yes.
So you take the pills, if you need, like you said now, pills and like you. Some pills make you sick.
Every medicine has side effects. So if you feel any side effects from your medication you just started taking, notify your doctor, they will change, they have alternative, they will change it to different medicine, and then that might not be the one. So that's how we handle that. Alright, go to the chapter on diabetes. Yes, sir. Oh, okay, see, brother, thank you for doing this. So type 2 diabetes is the diabetic who spend about 10 minutes a day. Type 2 diabetes is called acquired diabetes. You acquire it. Means you have gone or someone has gone crazy on diet, eating anything they like, drink anything they like, and then they mess up their sugar and put a lot of cholesterol in the body. That's called acquired. You are it. So that's type 2 diabetes, right? And there you have insulin still pumping the pancreas is still pumping the insulin to help digest the sugar, but over the period of time, that insulin becomes insensitive. It does not work much anymore. So then, if you have taken 15 units of insulin last year, this year you have to add another 5 units or 10 units of insulin in order to have the same effect. Right? So that's how we, in addition to if you're taking medication, that's all we nowadays and other stuff.
Some, I know some diabetics take the pill, some have to take the injection. Could you explain the difference?
Clarify that, I'm sorry.
I said some diabetics take one of them, some just take a pill. And then some have to take the injection. Why is that? What is the difference?
Okay. So some people, the question is, some people take pills, some people take insulin. What's the difference? Depends on what sugar you have in your body, how bad the sugar is. If the sugar is controlled by diet and exercise, number one. Number two is pills. If the sugar is controlled by that, then you are good. If even with the 2 pills, 3 pills, and all the 4 pills in the market for diabetes, and your diet and exercise is not helping you, then you are candidate for insulin. Because insulin, you have to inject the blood pressure.
What is your opinion about the injection that they give you? It's like a combination with diabetes and weight loss. What's your opinion?
There are a lot of side effects. Ozempic has a lot of side effects coming up in newer medication. That's why we stop because side effects are not. Your question, if it is meant to be, there are 2 different kinds of insulin. One is called short acting, one is long acting. So their baseline, one is baseline, you take that in the morning, for example, that is going to slowly digest your sugar over the next 24 hours. And then there are short acting, for example, you want to have your start and your sugar is going to spike up. Then you're going to inject yourself with 10 units of insulin in order to digest, have the sugar divided from the food. Okay, B is diabetes, right? B is for discipline. D is for diabetes. I'm just putting this two together. It's not even breakable. D is for diabetes. D is for discipline. In other words, if you want to maintain your sugar, you have to discipline yourself. Okay? This is the gist of the whole thing actually. Ramadan is a big time to discipline ourselves. Right? Discipline ourselves. We are eating no drink, no food from sunrise to sunset. It's a big discipline. It's a big discipline. I relate a story all the time on this. Once I had a patient who weighed 475 pounds. The patient was 475 pounds. I asked him, I said, what do you eat for lunch, for example? He said, for a typical lunch, I eat a large pizza with 2-liter Diet Coke. You want to just use that? A large pizza with 2-liter Diet Coke is the person's 475 pounders typical lunch. And believe it or not, the people who are obese and that big, they have a guilty face already. When they especially come to medical provider, right? But this guy, he said, I like to lose weight. I like to stop eating, but I can't. He's a failure in himself. Compared to that, 2 billion Muslims are fasting in this month of Ramadan. The difference between him and us, our willpower is stronger than his. He doesn't have a willpower. He is defeated already in himself. Right? So, Alhamdulillah, as Muslims, this is our gift from Allah subhanahu wa ta'ala, that we can control your desire. Right? We'll talk a little more on this a little later. Anything else on the diabetes? Yeah.
There's a lot of people who are now taking diabetic cells to the brain,
Okay, so there are people obese who take metformin or glucophage, and it does work on losing weight. And they do that, which is okay. Which is okay as long as they have good kidneys. Because glucophage and metformin has some effect on kidneys. If you have good kidneys, you could take it. But diet and exercise is the first line treatment for overweight.
The person is constantly junk food, right? Expecting to get over the fact sugar. So I stopped eating like that. Good. That's why I want to. If you say yourself like sugar, you need to
We do it. It's all. It's right here.
You see the fast food
I'm still going. I'm still
you know, attracting people, right? So good thing you stop. So then yeah, I need to mention it, I have it in the slide. So dementia, forgetfulness, is believed to be same way microvascular disease. In the brain, we have tiny vessels inside. In dementia people, CAT scan and MRI seems to show their brain shrink. And they are saying that it's because of less blood supply in the brain. Again, that's related to microvascular disease. Yes. Plant-based diet. So you have to sit down with your nutritionist and you have to plan what you can consume to keep yourself up. Okay? That has to come from your nutrition and your. Yeah.
When we talk about diabetes, that's also a reference to sugar as well, right? Sugar becomes in a sense, a physical addiction. Because some people go for withdrawals when they don't have the sugar in their body. And they wind up consuming large amounts of it. Just like a drug addict.
You sound like this overeating is an addiction. That's what you sound like. Overeating is an addiction, it is an addiction. And as myself, 475 pounder is an addiction for him to eat. He cannot stop. Therefore, he is as good as taking drugs. But if he cannot stop, even though your body doesn't need it, you keep eating and eating because you're addicted.
He can't stop eating, so he gets sick.
His sickness is 475 pounds. Right? Okay, so we'll move on to inshallah obesity, which actually is basically what the question came up on to discuss actually. Only thing is the definition of obesity is you have excess fatty cholesterol in your body. And the root cause of that is, let's say your body consume, in order for your body to function properly, you should consume only 3,000 calories per day, right? 3,000 calories per day. But if you're going to consume 5,000 calories per day, that extra 2,000, either you have to burn it by doing exercise, right? Vigorous exercise, or that extra calories are going directly where? Right here. Right here. Alright? So the best thing is rather that was your nutritionist is gonna do. If you need only 3,000 calories, then you should not take more than that. That extra calories will go accumulate in the body as fat tissues. And that's cholesterol and everything else.
So, when I was young, I played tennis 7 days a week, all through the winter. As I got older, a lack of that had not burn off as much as you take in. Even when you eat less, it's still harder to burn off. Even in activities that your body change, injuries from sports, whatever it might be. So basically, to use a controlled diet and some type of minimal amount of exercise, can that go together to maintain you? Now, because I know, like, I'm 6'4", or 250. And some things I consider slightly over because of my height and my bone structure. What is it based on your body percent of fat?
So average people's body, in order for the body to function properly, average people, I would say 160 pounder. I think 1,600 calories is the max you take. Unless you want to take another few hundred and you want to burn it by exercise. So this is at some point of our life that with age we are at, we have, in order to be healthy, we want to calculate all of this. What I'm burning, what kind of metabolism. When I was 16 versus 60, we have to figure it out in order to.
I don't mind the fact that it's changed a lot. So far, it's from where I know how we started, I was almost 200, like, January 87. I'll be 66 this year. But it's funny, I go run down, I burn quickly. When I fast like this, I don't burn.
Anything else on the obesity?
So
I got something, sir.
If you fast, you not get your water or drink, you exercise. You exercise. You walking, when you walk, I walk in the country. Cars get contact, but I walk back up the thing.
Abhimale, you are asking in the daytime, nighttime we are eating a lot, so we are kind of compensating for fasting. So you got to do whatever you need to do to keep.
How you said, like, I started doing, I lost like 10 pounds, like last, like, once I started walking to the Masjid, that's like real, like, it's like, a lot of times, I drive, but sometimes when I'm lazy, just drive around the corner. I walk places, but it's like, just an hour away, I walk. The hour's not that far.
So, I mean, if you need to lose weight, then see a nutritionist, they will give you a good plan. You go accordingly, inshallah. If, any other question? Yeah. I remember water, yes. Listen, my brothers and sisters. Plain water is the best. There is a brand called purified water. It doesn't make sense to me. Water is natural thing. You don't have to purify it, right? Purified water. So what I'm saying is, to answer your question is, the drinks out there, except plain water, all those drinks have something in it that is not good for health. So I would stay away from all those drinks. I'd rather drink, plain water.
What about alkaline?
Why is that for? I'm just curious. If you need to drink water to hydrate yourself, drink water. Why don't you? I will not go for that. It has something, read the ingredients. They always do something to make it taste bad. Okay? This is, huh? Some people don't like it. That's why they drink it. But plain water is the best.
We can also like a pH.
So you don't recommend pH level, pH level water?
Your pH level is decided by your body. Your Allah subhanahu wa ta'ala made your body such a way, your pH level is balanced. Your kidneys are there working properly. If it is too much acidic, try to get rid of it. If it is too much basic, try to get rid of it. Always balance it out. Right? So let me I think we can just less than 1 hour to get that. I just want to connect a few things here together. I think I touched on already. This is a Ramadan health awareness event. The reason I put the word Ramadan in there, because when it comes to health, there are some discipline that we need to maintain in our life. As I said, 1/3 of the population in this country is overweight. This country spends $1 billion each year on hypertension or maintaining high blood pressure. About $500 billion spent on diabetes. $500 billion spent on diabetes. Many countries in the world that don't have a national budget for $500 billion, which we spend here to take care of diabetes. As Muslims, if we can implement the discipline of Ramadan, take it out there save billions of dollars in this country, spending on diabetes. I think Ramadan by itself is something very, very important to take it out there to these people. Saving, making our health, as well as saving the money spent on this disease. High blood pressure, diabetes, obesity, high cholesterol. These four diseases you can control by discipline of Ramadan if you can carry out rest of the 11 months of the year. Trust me, I heard from the patients, I heard from friends, I heard from different people. In the month of Ramadan, they are healthier than any other month of the year. Their sugar is controlled, their cholesterol is controlled, their appetite is back. Why? Ramadan. Take this lesson, carry it on throughout the year. The medication you are on to control your sugar. If you just keep up with the discipline of Ramadan, inshallah, you're going to be able to get rid of medication that has side effects. My brothers and sisters, pain, P-A-I-N, pain. Pain in your body, the pain you have in your body, that high blood pressure is a pain. Cholesterol is pain. Diabetes is pain. Obesity is pain. All these are pain. In order for you to stop that chest pain, you take Tylenol to control the pain. That's not worth it. Your body is asking you, pay attention to me, I have pain here. Your body is telling you, pain is a form of complaint. It's a mercy of Allah subhanahu wa ta'ala. Body is complaining to you by presenting you as pain. So if you give a Tylenol to the body to stop that pain, you are not curing the root cause of pain. If that fire alarm goes off in your house, you don't go turn off that fire alarm. You call the fire department to come. There is a fire. The fire department is telling you there is a fire now. Call the fire department to extinguish that fire. That pain is a complaint of your body to you, telling you something wrong here. Check me out. So you don't take time or painkiller to go to the doctor, check it out for yourself. Right? So Ramadan comes once a year. It is giving us a valuable lesson of controlling that junk or the food that is not healthy to eat throughout the year. It's teaching us a lesson. During the time of the Prophet, they didn't have a lot of sick people, right? And now, compared to us, as I said, 1/3 of the population is overweight or obese. That's not coming automatically from someone. Someone is working hard on it to be obese. Then high blood pressure and cholesterol and diabetes. Putting all of this together, my dear brothers and sisters, it's an epidemic. Obesity is an epidemic. It needs to stop. And it's totally on our willpower. If you can stop yourself, I'm sure most of you are hungry since those time until now. If you can stop taking food and drink these 5-6 hours, that's the willpower Ramadan gives you. And it is asking us to build on that willpower. So that willpower you're going to use throughout the year to control your diet. Control your diet. I will go further. That willpower you're going to use if you have a bad habit of drugs. alcohol, or any other bad habits to your cell phone. If you can control all of those by this willpower. This is the essence of Ramadan. Allah subhanahu wa ta'ala is teaching us. لَعَلَّهُمْ تَتَّقُونَ. Maybe you become God-fearing. Right? In order for us to be God-fearing, we need to be healthy. So this is the message that Quran is giving us. This is the message that Allah is giving us. And we ask Allah subhanahu wa ta'ala to strengthen our iman, make us stronger in our health, and give us a lot of willpower every Ramadan so that we can become kuntum khayra ummatin ukhrijat lin-nas ta'muruna bil ma'ruf wa tanhauna 'anil munkar. And Allah subhanahu wa ta'ala said, you are raised as the best of the nation so that you can tell people to stop doing that and you learn good and you believe in yourself. So we ask Allah subhanahu wa ta'ala to give us that ability to make that love, to become best among the nation, so that we may not have the missiles, may not have the arms that they're selling to different countries. But if we can have this become the best nation, and the people are going to look at us, people will learn something from such. This is the message of Islam. May Allah subhanahu wa ta'ala make us strong. May Allah subhanahu wa ta'ala help us. May Allah subhanahu wa ta'ala make us best and best every year Ramadan pass so that we can get to the Ramadan. If I offended you, forgive me. If you have done something good, may Allah subhanahu wa ta'ala praise you. Inshallah, the only thing is people don't. No, it's not only we busy. People don't show up much, but they should. They don't show up. I was expecting a lot of people today actually, compared to that, maybe there's some of them watching from the streamline. But it is something very important. Very important. So, I hope we'll maybe come and talk to the committee and see if we can come up with a monthly day that we can discuss this. All right? Assalamu alaikum wa rahmatullahi wa barakatuh.